Hello everyone, and welcome to the Mayor's Youth Council Talk Show. I'm here today with Dr. Beth Rutkowski to talk about early suicide prevention. So Dr. Rutkowski, can you give us a little background information about yourself?
Okay, I am a psychologist and I work in Farmington Hills.
Okay.
And at my practice, myself and a social worker named Jessica Kushler, we work together to work with children, adolescents, adults, and basically we're there to help people who are dealing with depression, anxiety, substance abuse, life changes, anything that you're going through where it seems like you might need a little bit of extra help, we're there to be that help.
Okay. So as a psychologist, what areas do you specialize in?
Well, I work primarily with substance use, anxiety, and depression.
Mm-hmm.
So these are people who are coming in and they really just know they want to make a change in their lives, or they have support systems. They may have parents or friends or other individuals that may see they have a problem and bring them in for help. And being a psychologist is different than being a psychiatrist.
Right.
Being a psychologist is more talk-based therapy, whereas psychiatry is more medicine-based therapy. Those two individuals can work alongside each other, and again, it's up to a person if they feel like they want to use individual therapy, group therapy, family therapy. All those different options are available. They're all different types of therapy that I conduct, and it's great to try to find that balance for each person.
So what is your favorite part about your job?
That's a great question. I think it's usually watching people learn they can make a difference in their own lives.
Right.
Because a lot of people who are coming in with either suicidal tendencies, with substance abuse problems, with any kind of anxiety that seems to be overtaking their lives, they feel like they've lost hope. They feel like there's not too much left they can do. You know, their symptoms have kind of taken over their lives, and really watching as they get better and they see that they can make these changes, it's the best part.
So what advice would you give to anyone that's thinking of going into psychology?
Well, I would say, first of all, to make sure that it's something that you love.
Right.
It's a job that can be intense at times, but it's a terrific job, and it's one that I love a great deal, and people who love it seem to be the best at it. People who want to be there and want to do the work, it feels like you never work a day in your life, and it's great to find that. So.
Right, you have to love what you do, and I know that it's probably very rewarding when you know that you've helped someone.
Yeah, very much so.
So who is at risk for suicide?
An important thing to realize when it comes to talking about who's at risk for suicide is that really it's everyone. It's not as if it only affects a certain type of individual. It's not as if it only affects a certain race or ethnicity or a certain gender or a certain age. Really, anybody is susceptible to suicide, and that's why we need to be so aware all the time.
So what are some early warning signs for suicide?
Well, when it comes to suicide, certain risk factors include, someone who's dealing with a mental illness or someone who's dealing with a substance abuse disorder. So if you notice that someone seems to be exhibiting some of the signs of depression or substance abuse, those are two huge indicators that they might need some extra help. And depression manifests itself differently in different people. For some people, they become very withdrawn. They lose interest in their friends and their family and activities they used to really enjoy. Other people have a really hard time sleeping, or they don't really have an appetite. You see people who just their demeanor changes in general, and they may be someone that you used to think was a very bubbly, exciting, happy person, and suddenly they seem more hopeless, or they just don't seem to feel like there's too much direction in their lives. And those are some warning signs of depression, which is definitely linked to suicide. And when it comes to substance use, that's something else that we can keep an eye on for people. If people are using alcohol, marijuana, any other drug, it does definitely increase the risk of suicide.
Oh. So how can you tell if someone is having a bad day versus someone who is attempting suicide?
Well, there's no surefire way to know if someone's going to attempt to take their own life. But there are certain things you can watch out for and things that tend to happen more often when someone's in that place. And these include behaviors such as really not watching out for themselves, acting as if they almost have a death wish, so taking risks that really they don't need to be taking, driving very fast or spending time in areas that really aren't safe. If they're talking a lot about death, or if they seem to be thinking a lot about death, as a friend or a family member, this might be something that you notice. If they start saying goodbyes, if they start giving things away, those are really common behaviors as well. And one thing that's actually really important to realize, that if someone does talk about wanting to kill themselves, it's something that we need to take very, very, very seriously. Most people who do try to take their own lives have reached out for help before. Some people seem to think it's just a cry for attention, but really it's a cry for help.
Right.
And that's something that if a loved one reaches out to you, you can provide for them. One of the biggest warning signs for suicide is hopelessness.
Oh.
So if you're speaking with someone and they really don't seem to have much hope for their future, that's something that indicates right there that it's more than just a bad day. It's more than just even just depression. It's really them feeling like there's no hope in their future, and that's something to be extremely aware of. And like you said, it's one of the most gratifying parts of the work is that hope.
Right, that you can tell them that they have a great future ahead, and if they just keep on the right track, they can do great things.
Which is something that you or anyone else can do too if someone comes to you with those kind of problems. Remind them of their strengths, remind them of their future.
Yeah, tell them not to give up.
Exactly.
So earlier you talked about how dangerous alcohol and drugs is for someone that is thinking of attempting suicide. Why is this so dangerous?
Well, a few different reasons. The first reason being that drugs, alcohol, they lower your impulse control. So something that may be a fleeting thought, when you're actually able to work through the steps and the process in your mind when you're not intoxicated, you're a lot more likely to take that fleeting thought and run with it and do something that obviously is going to really hurt you, hurt the people around you, just because you don't have that same ability to stop and think when you're intoxicated.
That makes sense.
And another reason that it's so dangerous is the fact that drugs and alcohol, obviously people take them for the high, for the euphoria, for the calm, for whatever different effect they're trying to get from the substance. However, the flip side of that coin is, with the high, you get the low. So as you're withdrawing and coming down from the high, you're going to be more likely to feel depressed, more likely to feel anxious, more likely to have all those feelings that you were trying to avoid with the drug to begin with. And at that point, someone's far more likely to kill themselves.
So if someone confides in you that they want to commit suicide, but they tell you not to tell, what should you do in that situation?
And that's actually a very common situation.
Right.
However, it's important to recognize that they're turning to you for help. Whether they really are ready to admit that or not, they're turning to you for help. And there's a few different things you can do. The first thing you need to do is make sure, especially if the person is saying that they're actively suicidal, don't leave them alone.
No.
So if you're with them, stay with them. If you're not with them, try to get somebody to be there with them. You can call 911, especially if they're actively suicidal. Calling 911 is the best thing to do at that time. And there's also other resources that you can utilize. If they're telling you that they're feeling depressed or they're feeling that they've had these feelings in the past, Common Ground is a great resource for them. They have a website. They have their phone number is 800-231-1127. You can call them at any time. That's their crisis line. There's also the National Suicide Prevention Line, which is 1-800-273-TALK. Both of those are great resources that are available all the time for someone that's going through a difficult time. And the hospital can refer you to other individuals who can help you. There are psychologists like myself in the area that are available to help. There are programs through hospitals, through community mental health facilities. There's a huge amount of help out there. Definitely. And helping them take that step is what you can do as a friend or family member.
Right. So you discussed how if someone is very suicidal, they would go into a hospital. How would you be able to detect if someone is, urgently going to commit suicide?
Well, one thing that we talk about, and this is something that you can use also, if you're talking to a friend or a family member that seems to be having these kind of thoughts, is that they have a plan. And a lot of times people will talk about how they don't feel like they want to live anymore, talk about how, they wish they were dead. And those are, of course, huge warning signs and signs that people need help. But if they talk about having a plan, if they talk about having the means, another huge risk factor is having firearms at home. That's a big risk factor for suicide. If someone knows they have pills in their cabinet and they talk to you about that, that's something else that makes you aware that this is a very urgent situation. They have a plan, and in those cases, if they have intention to follow through with that plan, that's when it's truly, truly urgent.
what do these different organizations, what type of treatments do they give to someone who is feeling this way?
So usually if someone is actively suicidal, which means that they have a plan to kill themselves and the intention of doing so, they'll usually be put in an inpatient treatment, which means that there's people there to kind of just keep an eye on them, to help them get through those initial extremely difficult days when they really are feeling like they don't want to live anymore. It's good to have that universal support around you all the time, helping you and keeping you safe. So those would take place at different hospitals or different facilities. And then once you get past that crisis point, there are different organizations that will help you with outpatient treatment or medicine if that's a choice that you decide to make, or there's group therapy, there's family therapy, all sorts of different options for people that really, if you walk into a treatment facility, they're probably going to be able to help you find what's best for you.
That's great. Yeah, a lot of options. So talk a little bit about Farmington Safe Group and how they can help people as well.
So Farmington Safe is a wonderful organization.
Yes.
It was started in 2010, and it's not a treatment organization, it's an awareness organization. Right. So their goal is really to increase awareness of the epidemic that is suicide, because it is an epidemic. We lose 40,000 people a year in this country to suicide.
Wow.
And that's the equivalent, just to kind of give you some idea of the scope, it's the equivalent of having 3 airplane crashes a week with 220 people on those airplanes.
Wow.
If that was happening, people would be ready to go, trying to do everything they could to fix these airlines, fix these planes, fix these circumstances.
Yeah, it would be all over the news.
Exactly. Yet somehow this is something that still bears such a stigma, and people don't do enough in talking to the communities and talking to their children and talking to each other about it. So it's another huge goal of Farmington Safe, is to decrease the stigma. Let's get the conversation going.
Right, that definitely needs to be brought up more often. So if someone is going in for suicidal treatment, what is something that they can expect?
Well, it's going to look different for everybody.
Of course.
One thing that's fairly universal is a lot of times we'll do a safety plan. And what the safety plan will help a person identify is triggers for them that make them start to feel suicidal. It also helps them write down warning signs, which they can share with people in their lives, so that they know, okay, when I'm feeling really depressed, I tend to withdraw, I tend to stop eating. It lets the people in their lives know these warning signs to look for. Also, on that safety plan, which the person will take with them, we'll write down names of people they feel like they can talk to and numbers for crisis lines like the ones that we discussed or other organizations that they know they can call. So for nearly anyone that comes in for treatment, that's going to be the first step, establishing the safety plan. And then from there, steps look different for different situations. If someone is actively suicidal, we would try to get them into an inpatient type treatment where they can be helped immediately. If somebody is talking about suicidal ideations that are more passive, that they thought about them in the past, we'll usually help them realize how big their impact is in the world around them. Being depressed, feeling suicidal is very isolating. It's very difficult to think outside of yourself and your immediate circumstances. So making those connections is hugely important. Helping them understand the people in their life that love them, how they might be affected, and also helping them realize that they have a future, helping them realize that there's hope for them and that there's hope for the world around them. Because that tends to be something that people lose sight of when they're really suicidal.
And that's very sad, because they could have a positive future.
Exactly, and there's so many resources to help them get there.
So is there anything else that you'd like to add about this cause?
I'd like to basically just make sure everybody knows how very available treatment is. I mean, even just going on Google and typing in, find me a therapist, or psychologist in Farmington Hills, you'll be able to find a bunch of different resources. The Common Ground webpage, extremely helpful also. There's all sorts of national organizations. You're not alone. No matter how alone you feel, you really aren't.
Okay, well, thank you so much for coming on the show.
Thank you for having me.
And thank you for tuning in to the Mayor's Youth Council Talk Show.